message that I want to send someone with a high priority, I can have it go into their inbox, have it in red, for example, and even have it pop up an alert. Be sure to take action on this. I'm just going to send this as a normal, and I'm going to send it out. By the way, you'll notice, by the way, I'm demo. Dr. DeCoster, you see I'm demo. I'm doing this because I don't want to have to log out and log in. I want to be able to see the messages. It's for the sake of the demo. I normally don't send messages to myself, or do I talk to myself? But I'm going to send it to myself, along with the other people. Okay? So look, I'm going to go into my messaging, and here's the message. So now if I pretend that I'm your nurse, she gets the message, and she goes, okay, I don't know if your nurses. That's why I said it may not be exactly what you do. I don't know if your nurse rooms your patients or if you have the receptionist or whatever. But this is just an example. Um, the nice part is when the nurse clicks on the message, it actually brings up the patient's chart. Okay, I'm going to come back to this Health Watcher alert in just a minute. So she doesn't have to go in there and then search for the chart. That patient's attached to the chart because I actually routed the appointment. Okay, she's probably going to want to get the patient started, so she's going to probably create a note, start a note going, right? And that's what you do now. They have them start asking them questions about why they're here, et cetera, before you come in. Correct? Now, our system is a templated system. It's not free form, free word. There is a definite advantage to a templated system. I'm going to give you real brief what the advantages are. One is a templated system is faster because I could just check off a few things in a template and the system can expand to my entire note. The other thing is with our templated system, everything that's in a template is tracked in the database. So I'm just going to go into this note, and you know what I'm going to do? I realize this, okay, I'm going to give this patient a, I know I forget what she was scheduled here for. I'm going to pretend she's here for a breast exam. Is that okay? I don't remember if this particular patient was oh no, this was not the OB. This was not the pregnancy. This was this was an established patient visit patient, I believe. So I'm gonna pretend she's here for a breast exam. Okay. So your nurse would say, "And you are here for?" And she goes, "I need to have my breast examined because I think I feel something." So she's gonna open the template for the breast exam, and you'll notice that the note itself starts with some intake information. Why are you here? So we have a box here. Now you'll notice that up here we have what's called a selector. If we have most common answers to why patients are here, we can open up. By the way, you get to design your own templates. Now, we will give you templates that other OBGYN practices of ours that are using it. And by the way, I might add, we have a couple of OBGYN practices that we've installed that are completely paperless. You walk into their office, there is no paper. Not one piece of paper. So everything that is in your current bulky chart will be on the computer, which also means that you will never lose a chart, okay? And you always have access to it. I mean, how many times do you get a call at home, patient calls and goes, my water broke, I'm going to the hospital, meet me there, and you go, but I'm not your doctor, because you're the one on call, right? So you can just very quickly, either from home or when you get to the hospital, bring up their chart. That is handy, right? Okay, in this case, this patient's here because she has breast pain. By the way, I could type additional information in here if I want. So I can type, drop down. I can also talk to the computer. I'm going to show you voice to text later on in the demonstration. If some of you dictate and really want to just kind of automate it in that way, you can do that. But with our particular templates, I can pick, point, type, I can draw, I can talk into the computer. All these types of data input are available. A lot of our competitors, they make you do it one way, and that kind of limits you. So you can do a combination of it. So you might have some types of exams that are just dictation, others that you are point and click, etc. Now the other advantage This patient, by the way, has no allergies. You notice that some of this information just got brought in. That's because we have a real database application. We have the ability in our system to take any piece of data and put it anywhere we want to look at it in the system. I could take it and merge it with Word to create Word documents, or in this case, I have a template that I have certain unique pieces of information that I don't want to have to, that I want to have automatically populated from the fact that they've been here before. We've already have their current medication list. We're bringing that medication list in. In this case, we do want to take the patient's blood pressure. Okay. Now remember, I'm the nurse, right, or the person taking. So I'm only going to fill in part of this. And I don't know how much you do, but you notice how the date came in, all right, and also their sex. And in this case, I'm actually putting the chief complaint up at the top, but this part of the chief complaint is actually going to be where the doctor is going to ask more questions about the chief complaint. So I'm going to leave this part blank, okay? Now I'm going to save this note as the nurse, okay? And I'm now going to also take that note, because I completed it, and I'm going to message it back to the doctor. I would pick only the doctor here, which is going to be me, and I'm going to say, she is ready, UD. What are the results you get when you do a urine dipstick? Is it either abnormal, normal, or is it a value? Again, as you can see, I'm not a doctor. You obviously are. Okay. Okay. Remember, we asked for the urine dipstick, so she sent it back. I could have put it in the note too, but maybe I want to do both. Okay. Now what you're going to see. Okay, I'm going to switch chairs. Now I'm the doctor. See how I was the nurse and now I'm the doctor? Okay. Yes, thank you. Thank you. Going to go back to my messages. I'm going to bring up only my messages. And you see, message came back. Now she would have, again, I'm wearing two hats. She would have completed that message, and that message will have gone away from everybody else's chart because we've roomed the patient. She roomed it. But now see, the doctor sees she's ready. UD is negative. By the way, some of our practices type which room they're in. That would be nice. She's in room 4, you know. Okay? So, once again now, I'm the doctor. I click on the message. What was sent to me? Remember? It was the note. All right. Now we have something I'm going to talk about before I get in and finish my note. I want to kind of navigate you around the chart so you can just see how we're storing the information, how easy it is to look at the information, etc. But you also notice that this message came up, and that is that we have a Health Watcher alert recommended based on the fact that this patient is female and under 55. See it? Health Watcher is a very powerful and a very important feature of the system. Health Watcher items can be triggered based on a number of different parameters. Age and sex. That's why this one was triggered. It can be triggered based on a diagnosis. So if a patient has a certain diagnosis and there's a Health Watcher protocol that needs to be followed because of a diagnosis, that can be triggered. It can be triggered on a lab result. Did a pap smear, became abnormal. We need to set up some Health Watcher items. All Health Watcher is, think of it as a huge tickler system. It will, where you can assign certain things that need to be done for this patient. I'm going to actually go into Health Watcher. Now I think this particular, I'm going to minimize this note and talk about Health Watcher right now. I'll come back to the rest of the chart, but let's go into Health Watcher first. By the way, this patient is already on a different Health Watcher item because this patient happens to also be pregnant in my demo. I'm going to actually take this one off so you can see what it looks like fresh. Now we're starting with blank Health Watcher items, okay? And if I click Open Assigned, it's going to show me all health